This is Dr. Ashanti Carter, Chief Academic Liaison with blackdoctor.org. So introduce yourself to the people, your name, organization, and tell us what you do.
My name is JaNae Kimbell. I'm actually the Vice President of the National Dental Hygienists Association. We are here at the NDA. It's a joint conference between NDA and NDHA, and we also have our students here and our foundation, and this is all a big family here in Kansas City. I'm excited to be here, and so we're just here to learn, to grow, and to talk about oral health.
All right, I love it. You said NDHA. What does that stand for?
National Dental Hygienists Association. So we're the premier organization for minority hygienists in actually all over. You don't have to be from the U.S. We accept people from everywhere.
What? Are you serious? Oh my gosh, that is so exciting. So talk to us, JaNae. What's the difference between a dental assistant and a dental hygienist?
Basically, it's education. So dental hygienists, we have about 3,000 hours of education that we bring to the table. We have to be licensed, go to CODA accredited school. We learn everything from all the basic sciences, oral health, microbiology. We do anesthesia. We do a lot of sciences. We do pharmacology because we do give anesthetics to get you numb during some of your cleanings. We do a lot of that as we also do mouth and body collaboration. So what happens in the body happens in the mouth. So periodontal disease is linked to diabetes, heart disease, stroke, preterm low weight babies, and so the bacteria in your mouth can transfer to all those body organs. So we are responsible for reducing inflammation, and eliminating all those harmful bacteria in your mouth so that your whole body can be healthy. Assistants, they are a great part of the team. They are kind of like, they assist us and they assist the dentist. They're the ones that are going to take your x-rays. They're the ones that's going to do probably your initial intake. When we do procedures, they're there suctioning, making sure that no saliva goes down your throat. When you get fillings with the dentist, they're there to help pass them instruments. For us, they help us suction because sometimes it's a lot of things that are in your mouth. When we were in there, water and a bunch of other stuff.
Yeah, like a juicy mouth, huh, JaNae?
Juicy mouth. So a lot of times they help us to suction. They help us to take x-rays so your time with us is meaningful. They get all that stuff out the way. Their education is probably 9 months at a dental assisting school, and some trained on the job. So we are a lot more, our schooling is a lot more intense than their schooling is, but they're definitely a great member of the team.
I love it. So can we say like a dental hygienist is almost like the nursing component?
Exactly. We are oral health practitioners, kind of like a nurse practitioner.
Wow, that is amazing. So can a dental hygienist hold a doctorate?
They actually can. I'm actually pursuing my doctorate in educational leadership. There are programs, there are master programs for dental hygienists, and a lot of us do go on and get a doctorate degree. Not necessarily a dental degree, because at that point then you will become a dentist, but there are a lot of hygienists that go on and become dentists, and there are a lot of hygienists that stay hygienists but get their doctorate in education.
I love it. I love it. So JaNae, you are a powerhouse as it relates to oral health policy. What's the significance of Nevada SB 495?
Okay, so that bill hit us kind of hard. We did defeat that bill as of right now. So what that was doing is it was allowing assistants to basically do our job. They were not going to have the same amount of training that we had, and it actually would have been harmful to the patients because they are not trained to use the instruments that we use, and the very sharp instruments that we put in your mouth. can be damaging to the tissue. It can damage a whole bunch of things if they're not used correctly. Also, it was allowing them to scale, and that's the scraping of your teeth, above your gum line. Well, the problem with that is, yes, we do a scale above the gum line, but we also scale underneath the gum line. And if you leave bacteria underneath the gum line, you can get things like periodontal abscesses. You can leave that bacteria to flow through your bloodstream, and that's not healthy. And so all dental hygienists were against that. And so we lobbied in Nevada, and we got the bill not to be heard. So it's still a battle, but it's going state to state to try to pass that assistance, because of access to care, that they are able to do cleanings, and that's just not safe for the public. Unfortunately, in Arizona, that bill did pass. They have assistants that are now being allowed to scale under strict restrictions. They do have to go to a CODA approved program and get, I believe it's 20 hours. I'll get the correct number in just a second. And they do have to be supervised by a dentist or a hygienist, but the catch to that is dentists don't even get the 3,000 hours that we get. So we are the most trained individuals to do your dental cleanings and to help prevent periodontal disease and to help look at the whole body as far as the bacteria in the mouth. So really the dental hygienist is the best person. So if you happen to be in one of those states that are going to pass that bill, you really need to demand that the person that is in your mouth, the person that is cleaning your teeth, is a licensed dental hygienist.
I love it. And you said 3,000 hours, right?
3,000 hours, and that's clinical hours and didactic. So that's both learning hours and actually in your mouth. Like, we actually have patients come to our school, we work on each other, and we are practicing in an actual mouth during the whole time we're in school.
I love it. So JaNae, what advice can you give us about taking care of our teeth?
The first thing is brushing and flossing. And I know that you guys hear brush and floss twice a day. Yes. I'm going to tell you something a little different. I'm going to say brush and floss after every meal, because guess what? That's when the bacteria gets in your mouth, after every time you eat. Flossing is super important. A lot of people ask me, hey, can I just water pick? And the answer is you can water pick, but in conjunction with flossing, because flossing is still going to get some of those areas that the water floss cannot get. So brushing and flossing, visiting your dental professional every 3 to 6 months, because some of you all who have periodontal disease need to come to the doctor a little bit more, come to the dental hygienist a little bit more frequently than 6 months. So sometimes it's 4 times a year, sometimes it's 2 times a year. We will assess that when we do your assessment. We won't know that until we see you, see how you take care of your teeth, see if you have already periodontal disease, any bone loss, that sort of thing. So brushing and flossing, your nutrition, drinking a lot of water, making sure that you're eating healthy. Those sugary foods gotta go. Sometimes it's hard, right? Or what I tell people, especially around Halloween time, is eat all your candy at one time and then brush it all away. Because every time you eat, you're introducing bacteria into your system. So you want to be able to wash that away. Mouthwashes are good. Let's see, what else? Eating healthy. I would also say, here's a big one. Change your toothbrush every 3 months. When your toothbrush starts to fray, or if you're sick, you need to change that toothbrush. Never share your toothbrush. You will be surprised, especially you couples out there think that it's okay to share your toothbrush. Never, ever, 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 ever share your toothbrush with anyone. And if you have trouble finding a toothbrush, reach out to the NDHA or NDA. We often have places where we can send you that can give you a free toothbrush, or we can even send you a free toothbrush. So please just reach out if that is you and you're in need of the toothbrush or toothpaste. That's the number one thing. Just don't ignore your oral health. And get this is not just for people who can't afford to go to the dentist. I see CEOs of companies who don't take care of their teeth. They have insurance and they do not come to the dentist. So make sure, if you have insurance, use your benefits. You get at least 2 free cleanings a year. use it. Use it. Yeah, that would be my best advice.
Excellent. So, JaNae, last question, and this is the real tooth, our little take on the real truth. When people think about healthcare heroes, dental hygienists rarely get top billing. What's the real superpower of your profession that folks are sleeping on?
I would say just coming to visit us they say we're going to the dentist, you're really coming to the dental hygienist, because if you notice, the dentist is probably in your mouth maybe 10 minutes and we're in there 50. Right? We're in there 40 minutes, 50 minutes, and we're in there just trying to make sure that we remove all that plaque, all that tartar in your mouth. And if you have excessive amount of tartar or periodontal disease, sometimes we're in there, sometimes we have you come back and we have you come in 4 sessions or 2 sessions, and we're in there for an hour each time. So it's a lot of detailed work in removing stains, tartars, plaque. It's detailed work. It's hard work. A lot of hygienists don't work for a very long period of time because it's hard on our backs and necks and stuff, because it's hard work. We're in there getting that tartar off and teaching you and educating you on how you cannot build up so much plaque and tartar. So it's not just about doing the work, it's about you partnering with us as a patient, because we can't be in your mouth every day. We can't go home with you. So it's about us educating you and teaching you how to take care of your mouth, how to brush, what position to put your toothbrush in, and then we get what you leave behind.
I love it. I love it, JaNae. Thank you so much for just flossing with us, because you're flossy and fly. All right, you guys, this is Dr. Ashanti Carter, and we're out. Woo woo!